Hi, I'm Andy Kelly. I graduated in 2001 with my associate's degree in nursing. In 2014, I returned to Southwest Baptist to obtain my bachelor's degree. I honestly had not done any research. I just knew that in order to obtain a raise, when you reached your full income potential, a bachelor's degree was needed. I had no idea what I was in store for. Becoming a BSN prepared nurse was not only proved to be a career investment for me, it has given me the knowledge and understanding of healthcare changes and has enhanced my critical thinking. I have increased clinical judgment and quality of care, developed leadership skills for diverse, complex healthcare issues, and have prepared to communicate professionally with coworkers and doctors. Liberal education increases clinical judgment and quality of care through evidence-based research, giving an understanding of the research process and application of the research to explain the recent changes in nursing. I have always felt like if it is not fixed, if not broke, why do we try to fix it? I did not look outside the box. It is now easy for me to integrate and accept these changes. Seeing the results of studies on hospital-acquired infections, the outcome of bedside reporting, and decreasing the rate of pressure ulcers obtained are just a few to mention. I now understand the benefits and the successful interventions of these changes for the patients. I will continue to accept the changes without hesitation. BSN nurses have lower incidence of pressure ulcers, hospital-acquired infections, and mortality rates. Leadership. I have come a long ways in my leadership. It has the impact it has had for my patients and my coworkers. Being able to identify solutions for diverse, complex healthcare issues determines effectiveness and stressful outcomes. Using leadership skills has proven to be cost-effective in healthcare. Leaders assess and develop professional skills, creating a bond with patients and the coworkers. I today am that leader, that I successfully involve my patients in their care and accept the changes in the nursing practice. I can now apply leadership principles and coordinate patient care in collaboration with interdisciplinary teams. Communication and skills. Team collaboration is essential. Patient safety is at risk when staff members are not communicating effectively. Lack of critical information, misinterpretation of information, unclear orders over the phone, and overlooked changes in status all can create medical errors. Errors that can serve injury or unexpected patient death. I will demonstrate effective communication and collaboration with my coworkers and doctors. Effective communication provides the most accurate patient information, and I will include my team to build the trust, respect, and the collaboration to provide the absolute best patient care that I can. I will continue my lifelong learning by understanding and executing evidence-based practices in healthcare. To obtain this, I will seek out knowledge and demonstrate understanding by accepting these changes in hospital policies and continue mandatory education in the hospital settings. I also believe self-reflection is an important life goal for learning. Self-reflection is a necessary tool for learning and growing in the nursing profession. It allows one to have feelings of satisfaction, yet at the same time, it can also be critical for improving your attitude and critical thinking. I will continue to do self-checks to determine satisfaction in my patient care, coworker relations, and accepting constructive criticisms and learning from my mistakes. I will continue to stand out as a servant leader by continuing to have the desire to serve first, showing my Christian faith, and then showing my leadership skills. Showing empathy to my patients, I will seek to understand their needs and empathize with them. I will actively listen to the family members' needs along with the patients to help educate, support, and to guide their decision making. I will help peers and coworkers to solve problems. I will teach and guide them in the nursing practices that build confidence within them, increasing self-satisfaction and patient safety. Within my personal life, I will continue to grow and heal, trusting in the Lord and finding comfort within, overall making me a stronger servant leader for myself and others. Reflecting back through this program has impacted me in several ways. I have grown spiritually. I have learned to provide holistic patient care. Before, I did not even know what that meant. My care provided was self-centered, meaning I did not recognize the philosophy. I was not aware of all the patient needs. I did not see the patient as a whole. I now comprehend that caring for the patients is more than just focusing on one area. Body, mind, and spirit are all needed to be taken into consideration. I have learned to care with hope, dignity, and most of all, self-discipline, creating an atmosphere for growth of all involved. Thank you for teaching me to improve the quality of care for my patients and to grow spiritually. Thank you.